Welcome everyone to the Reducing Barriers to Living Organ Donation with Hope Air Support webinar. My name is Candice and I'm the Education and Outreach Coordinator here at the Center for Living Organ Donation, and I'm also a kidney transplant recipient myself. At the Center for Living Organ Donation, our goal is to improve access to living organ donation for both recipients and donors, and that includes financial access. And so we want to make sure that no one is negatively affected to be financially out of pocket if they do the incredible act of giving the gift of life. So this is an information session that discusses supporting the gaps of what is reimbursable from PRELOD and other provincial reimbursement programs. And today is our very first webinar, so there may be some questions at the end. We're going to discuss the Give Life UHN Travel and Accommodation Fund top-ups, which support the government support with in-kind flights, ground transportation, and hotel stays for living donors and accompanying caregivers who must travel to the Ajmera Transplant Centre in Toronto for appointments and surgeries. And this fund is supported by the UHN Foundation and delivered by Hope Air, which we'll hear a lot about this amazing thing that we have partnered to do. So I'm very excited. We have some wonderful guests here with us today. First, we have Trina, who is joining us. She is a PEI resident and mother of two, and she gave the most selfless gift of an anonymous living organ donation. And with the support from Hope Air, she received the support she needed to travel from her hometown for the liver transplant surgery in Toronto. So we get to hear all about Trina's journey. And then later today, we'll be joined by Sarah Brigginshaw, the Manager of Volunteer and Community Engagement with Hope Air, and Vavini Solanki, the Client Manager with Hope Air. And we also have two people from the PRELOD program who have joined us. We have Leah and Andrew. Leah is the coordinator of the Transplant Managed Funds, and Andrew is the manager of the transplant programs. So if you have any questions about PRELOD as well, we can answer those questions at the end. So it is my pleasure to now turn it over to Trina, and we get to listen to her remarkable journey. Welcome, Trina, and thank you so much for joining us today.
Thank you for inviting me. It's exciting. There's a lot going on in the last little bit, so it's nice to be a part of this. Like you said, I'm a living liver donor. I donated a portion of my liver to a pediatric case. So it was a little person. To start my journey, I guess, when I was 18, a friend and neighbor nearby needed an organ donation. They needed bone marrow. So me and my sister signed up thinking, oh my gosh, this poor person is sick and we should try and help if we can. And never thought more than that other than, can we help? So we did that and went to a session on how that would go. And it really opened up our eyes to, there are people who are in need in the rest of the world and in their communities and, that aren't the same as us who, need help for medical reasons. So then the two of us both got put on the list. We weren't matches for our neighbor, but we got put on the list and continued to donate blood and sign up for other things. And it would have been a few years ago now, a local person posted again that her spouse was looking for a liver donation. And I signed up for a lot of things over the years and I wonder if I'm on that list. I didn't know, but I thought having been on the list twice is probably better than not being on the list at all. So I filled out the forms again and sent them in, not knowing what I was getting myself into or what it entailed. But all that mattered to me was, can I help? So shortly after that, I did get a call from UHN asking me some questions about my application. And then a few months after that, I got another call saying, let's start this process, and explain to me everything that I would need to do and go through in order to be considered a living liver donor. I'm not going to lie, at the day that I got the call, I was completely overwhelmed. Single mom at the time, with two kids, going to Toronto for testing, going to Toronto to donate, and then staying there for a number of days afterwards for recovery. That was a big feature to sign on for. So I was very overwhelmed thinking, okay, I want to help, but can I do this? Can I financially do this? Can I lean on my family to help with my kids? And I would also need a caregiver. So leaning on my family again to come with me, and I'm then putting financial burdens on them for coming with me. The process was quite overwhelming at the time, and I had to take a few days to really think about it. What does this entail? And amazingly, UHN has this really great manual that they emailed me that gave me all of the information, everything that I would go through, the programs, PRELOD, Hope Air, everyone who is on board to help out. And I continued the process day by day, step by step. I did testing here on the island. Like she said, I'm on Prince Edward Island, so I'm a little ways away. I did some testing here. I eventually went out to Toronto again, or the first time, I guess, I went out to Toronto for more testing. Hope Air took care of booking my flights. Hope Air took care of booking a place to stay. All of the process. I had never been to Toronto before at that time, and I didn't know where I should stay. I didn't know what I should be looking at as far as being distant, like a close distance from the hospital, all of that. I didn't have to worry about any of it, and flew me home again, booked all of that. When I went back after I was approved and to get ready for the surgery, again, Hope Air booked the flights for me and my support person. They booked a place for me to stay, booked our flights home. At a time when you are doing something like this, there are so many intricate pieces to this puzzle that make this work. And I've said it to people because I'm an advocate now for helping as much as I can, but I've said it a number of times that UHN, their focus should be on the medical, and they're the experts on the medical. And I love that they can focus on the medical. My part is to be healthy, to recover, and I can focus on being healthy and recovering because people like Hope Air, they can focus on the bookings, the flights, this is their expertise part where they can focus on, the flights to get you there and back again, the great places to stay. They took care of all that for me. And it's really, it's such a wonderful process to hear that everybody is, grouping up and working together now and making it a seamless transition from one piece to another for the people who are interested, because it's not an easy feature. It was a big undertaking for me, and I'm very happy that I was able to do it. And I didn't have, those financial burdens on top of anything else that I had to do as far as my home life and my work and everything else. They took care of those things for me. And, if there are people out there who, have the health and they have the heart and they have the generosity who want to help, and if financial burdens is what's holding them back, it's sad to think that, they would be capable of saving someone's life, but they can't afford to. Like, putting this all together and having a group of people work together like this to make these opportunities possible for these people to help save lives. It's great. I'm happy to be here. I'm happy to speak. I'm happy to answer questions, because to me, this, it's just what needs to happen. It's just what needs to go together. UHN can focus on the medical, people can focus on healing, Hope Air can focus on helping people get to where they need to be and back home again. So that's my portion of the show, I guess. And I'm happy to answer any questions or help or in any way possible. But I hope that's the gist of my section and how important this all is for people like me. So thank you.
Wow, beautiful. Thank you so much, Trina. I can see in your face how enthusiastic you are as well. So, you've been through a remarkable journey, and we're so grateful for what you've done for someone else and now what you're continuing to do for the community. So thank you so much for joining us today and for sharing your story and continuing to talk about this incredibly important resource for people. And now I would like to introduce Sarah, who's going to discuss all about Hope Air and the amazing things that Hope Air does. So I'm going to turn it over to you, Sarah and Bhavini, and feel free to share your screen as well. Thank you so much.
Welcome everybody to the Hope Air portion of the webinar. So we're going to dive into Hope Air overall, how we work, and Bhavini is here as well to speak to the UHN partnership specifically. A breakdown of what we're going to be covering today. So we've got about Hope Air, that's who we help, what we provide, why we're here, really an overall view of what Hope Air is and how we're here to help. We have our impact, and that's the patient experiences, some key statistics, and overall impact of what we do. Obviously, with Trina sharing her story right off the bat, you already know a lot about the impact of Hope Air, and thank you again, Trina, for sharing that story. But we'll talk a little bit about that in this webinar as well. And then lastly, the ways that you can take action, specifically how to apply for travel, should you need it, or should somebody that, one of your patients or somebody that you work with, should they need it? Some FAQs that we often get, and then just a couple of things that will help us spread the word to others who could maybe be donors, but don't realize that the service is available. So starting with about Hope Air. Hope Air is Canada's only national charity providing free travel and accommodations for Canadians in financial need who must access medical care far from home. And essentially, we are helping patients who are of all ages with any medical need and from coast to coast. So there are, of course, other travel assistance programs throughout the country that we're so grateful for. They tend to be a little bit more limited in scope, either helping only children or seniors, for example, or patients with a specific medical concern or in a specific region in Canada. And so I did want to point this out that although this particular webinar is about the UHN partnership and transplants in particular, we as Hope Air are not limited to that in scope. We actually help folks of all ages, all illnesses and medical needs, and all across the country. And our eligibility criteria, so we're bridging the distance between home and hospital for patients who are in financial need and with a confirmed medical appointment that's covered by their provincial health plan. And so generally speaking, this is the criteria that would lead patients to be eligible for assistance with Hope Air. However, I realize that with the UHN program, some of these eligibility requirements don't apply. And so I'm actually going to turn it over to Bhavini briefly just to elaborate on that a little bit.
Thanks, Sarah. So yes, so the financial need and confirming the appointment is for our general Hope Air clients. However, specifically just for the UHN program, we are not taking the financial information, so we don't require the gross household income within the last year for patients who are traveling through the UHN program. And as well as the medical appointment, we don't require confirmed appointment. However, if there is some sort of paperwork that can just confirm the dates, that's all that we would require to move the request forward. Yeah.
Great, thank you. As far as what we provide, we have a number of programs that we provide. There's the free flights, which is what we're best known for. It's what we've been doing since 1986. And most of those flights are on commercial airlines, but we do also have a volunteer pilot program. That's one of our volunteer pilots pictured there. And they can help us reach communities that are smaller and that are maybe not serviced by commercial airlines or serviced very often by commercial airlines. And so they're able to provide direct flights into the cities where these patients have their appointments. We also provide free overnight accommodations through hotel partners, which is something that Trina also mentioned. And I provided the Chelsea Hotel in Toronto as an example because obviously with UHN, that would be the most likely to be used. And we've got hotel partners across the country, and even in places where we don't have partners specifically, we're still able to provide accommodations in their appointment city. We've got bridge and ferry passes for PEI residents. A lot of the specialist care is actually provided through Nova Scotia and New Brunswick. And every time patients have to travel across the bridge or taking the ferry, there's a fee and a toll associated with that. And so we provide those for free. We've also got ground transportation to and from the airport in select cities. This is through Uber. And so essentially this is available in any city where Uber exists. And we've also got meal vouchers in select cities through hotel partners and also through Uber Eats. And so these are both new programs this year. They were in a trial phase for the majority of the year, and they've recently been expanded. And we are working to expand it into as many cities as we can. They're not available everywhere, but we're really trying to increase the number of cities where they are. As far as why Hope Air exists, why we're here, there are 3.2 million Canadians living below the poverty line in Canada. So nearly a tenth of Canadians are living below the poverty line. 3 out of 10 Canadians, so roughly a third, live outside of city centers. And so it stands to reason that at some point in time, they will likely have to travel into a large city for specialist medical care. And also 40% of Canadians would not be able to afford a $1,000 emergency. And as you can imagine, with the flight prices in Canada and just all of the costs that add up when it comes to medical travel, it would provide a real financial barrier for patients to reach that care when they do need it. We also ask our patients what they would do if Hope Air didn't exist. And so the largest number would travel by ground, either by driving or by bus, anywhere between 4 and 12, even sometimes in some cases more than 12 hours each way. Obviously, this takes a lot of time. They have to take time off work to do this. Oftentimes, because of the nature of their illness, they're not able to do the driving themselves, and so they have to find somebody else who can accompany them. And it's a real tremendous burden for these patients. The blue section there are the folks who would borrow money to purchase, and that might be from a friend, or it could be incurring debt in order to get the medical care that they need. The most concerning for me, though, is the yellow section there, which is the 30% of patients who would cancel or postpone their appointment, which means that they are ultimately delaying or completely canceling the appointment that they need, which could be life-saving in a lot of cases. I am a bit of a history nerd, and so I figured I would include a little section about a brief history of Hope Air to give a little bit of context about where we started and how we've grown over the years. So we were founded by Joan Rogers and Ginny Bradshaw. Joan was a volunteer with the Princess Margaret Cancer Centre in Toronto, and Ginny worked for Air Canada. And in Joan's volunteering, she saw that folks were driving from the East Coast to their medical appointments at Princess Margaret, having their appointment, turning around and driving straight back up to 20 hours, 24 hours each way. And simultaneously, Ginny with Air Canada learned about some not-for-profits in the States that were using corporate jets to fly folks to their cancer treatment. And they started talking and they realized that there's a real need in Canada for folks to have access to their medical appointments. And so they founded the Mission Air Transport Network. By 1986, there was the first flight from Newfoundland, and that was helping a young child get to their cancer treatment in Toronto. Oh, sorry, I said Newfoundland, I meant New Brunswick. In 1987, Air Canada donated 12 flights, and now we have donations from a number of airline partners across Canada, but it all started with these 12 flights, which led to this just enormous contribution from airlines. In 1993, we reached 10,000 flights, and so it was growing incredibly quickly. At the time, the model that Mission Air Transport Network was using was largely based around corporate partners donating their jets to fly patients to medical care. And it's since changed quite a bit. In 1996, WestJet was founded, and immediately they donated their first flights to Mission Air Transport Network shortly after being founded. And WestJet is now one of our largest airline partners. I believe it might be our largest airline partner. And so they've just been a huge supporter of ours throughout the year. In 1999, we rebranded as Hope Air, which is what you know us as today. And that's when we introduced the volunteer pilot program, which I mentioned earlier, helps us. We've got about 50 volunteer pilots across the country who help us reach different communities that are not generally serviced by commercial airlines like WestJet or Air Canada. We also have a national honorary patron program, which has included folks like Mark Garneau, Rick Mercer, Roberta Bondar, and that began in. Moving right along, we have the RBC Avion Points Donation Program, which was launched in 2004 and continues to this day. This is how people can donate their RBC points, and we can use those to purchase flights. In 2010, that's when we started fundraising and actually purchasing flights ourselves, and that allowed us to expand what we were able to offer to patients all across the country, and we just started growing exponentially after that point. In 2015, as I mentioned, we were growing so quickly, we reached 100,000 flights. In 2016, we launched that PEI Bridge and Ferry Pass program that I mentioned earlier. 2019 was the accommodations program. 2020, we reached 150,000 flights. I believe our current is around 160,000. Is that right, Trina? And then in 2022 was the launch of Rides and Hope Meals. And so really just in the last few years, there's been tremendous growth in terms of what we're able to offer. Our goal is to be a full service travel support system for patients who need to access medical care. Oh, there we go. Next up is the impact. And so here's one of the many testimonials that we have from our patients, also from PEI. And this one says, without Hope Air, my wife would not have gotten the surgeries to save her life. We are forever in your debt. Without you, we and so many others had no way of getting the help we needed. I have another example here, which is a little bit more to you folks at UHN. I wanted to share about Lisa, who's pictured there on the left, who was diagnosed with polycystic kidney disease. And by 2018, her kidneys were failing, and a situation that I'm sure is familiar to many of you, either from yourselves or folks that you know or work with, is that her only option was lifelong dialysis or a kidney transplant. And an acquaintance that Lisa knew through work found out about her situation because she and her daughter had been sharing about it on Facebook, and that acquaintance also shared it and ultimately reached Susan, who's also in the photo there. And Susan is a retired travel agent who happened to be connected to Lisa's acquaintance, and one thing led to another. They started chatting, and Susan flew from BC to Winnipeg using Hope, and they had their procedure done, and Susan was actually recovering at Lisa's home with her family for the week afterward, and they've just become very close friends through it. They make sure that they call each other on the day of their surgery every single month just to check in, see how the other is doing, and they've stayed connected all this time later. And so in Lisa's words, she said that I would not be here today without. So I have a brief summary of some of the stats from 2021. I realize we're almost at the end of 2022 at this point, and those will be released in the spring. But based in 2021, we were able to provide 4,500 flights, 625 bridge and ferry passes, and over 1,600 nights of accommodation, just to give a sense of the scope of what we're providing. The flights the numbers are a little bit lower due to the pandemic. Some of that is great that folks are able to access virtual care more often, but we also do know that there's backlogs in the system and other reasons why folks aren't traveling. So I figured I would mention that. The medical needs that patients are most often traveling for with Hope Air are cancer, musculoskeletal disorders, nervous system disorders, and cardiovascular disorders. Our youngest patient was less than a year old in 2021, and our oldest patient was 93. So really a wide range of folks that we're able to help. And in the last 36 years overall, we just celebrated our 36th anniversary. We've relied on help from an amazing team of volunteers and fundraisers. They donate about 5,000 hours of their time every single year. And of course, I'm the volunteer engagement manager, and so I would be remiss if I didn't talk about just how much we appreciate our volunteers and how much they make it possible to do what we do. We've helped tens of thousands of Canadians reach medical care far from home, and we've completed over 160,000 travel arrangements. And as far as how this all relates to you in your situation, this is a screenshot of our website as it is right now in November 2022. We've got the travel help button on the top right corner, and so that's where you'll click if you have a travel request to submit, either for yourself or on behalf of someone else. That'll take you to this page here, and so when you're ready to apply, you can click on that button there. Alternatively, if you have any questions at all, that's the page that you can go to access the travel FAQ. There are so many questions and answers there, all organized by program. And so if you have a question about how many nights you can stay for the accommodations program, for example, you can head over to the travel FAQ there, and we've got 70, 75 answers to questions there. I also wanted to point out on the bottom left-hand corner, there are some accessibility options for the website if you were to need it. Just wanted to draw your attention to that there as well. Just showing what the form looks like as far as filling out a travel request form. There's a number of pages there, but you can sort of see your progress throughout the form, and that is how it looks, so you're familiar. And I will hand it over to Bhavini here, who's going to talk a little bit about some of our frequently asked questions from her client care perspective and share a little bit of her expertise there.
So let's go to the first question that we normally get is, what is Hope Air's financial cutoff to qualify? So it's a two-part answer. So very specifically for the UHN program, like I mentioned earlier, we're not taking any financial means, so we're not asking you to provide us any information about that. However, when you are filling out the form, I will ask that, when you get to the income section, you would have to put a $0 value in order for the request or the request to move on to the next page. However, if this is just a general question, most of our patients make between 15 to 50,000. That's not to say, if somebody made 50,000 or they made 60,000, that, oh no, they won't qualify. It is based on the family, the size of the family, and also, maybe how frequently they may have to travel for the medical care. So it's looked at a case-by-case basis when it goes to our client care director, who reviews the request. Next question is, how long does it take to process request? So typically we ask for a 2 weeks notice prior to the appointment. We do understand, sometimes, patients get a call, tonight, and they're needed, tomorrow morning, or they're needed, in that same week. We are able to work with short notices. However, we have implemented a new policy whereby if an appointment is for the following business day, we do ask that those requests are put in by 4 p.m. Eastern Standard Time, just because, it goes through a process where we get your application, it then has to go through that approval queue, and then it goes into booking the flight. So there's a bit of a process there. Even though we're not asking for a medical appointment confirmation, it's just a step-by-step process before we can book a flight. So we can typically book a flight within the same week, if possible. Otherwise, we're booking flights the week before travel. In the application, there is a section where you would be able to select either you would want to get the information or the patient would get the information. So you'd be able to let us know on the web form who would like to get that email. So you would get the approval email, submission email, and the flight email, obviously through Hope Air. And we can go to the next common question that we get is Hope Air an airline or an air ambulance? So of course not. Hope Air is none of the above, but we do have partnerships with various airlines, like we mentioned earlier, with West Air Canada and Porter. And then more regional areas like in BC would be examples like Central Mountain Air or Pacific Coastal. We're not an air ambulance because we're not able to assist individuals who need to be on a stretcher or who need a medical staff traveling with them. So all our patients must be able to sit in a commercial aircraft.
If I can just add one thing
Yep,
as well.
go ahead.
There are some situations where folks will take an air ambulance into the city and then not have a means of getting home. And so in some situations there, we are able to help with the return trip after they've taken an air ambulance. But like Bhavini said, we're not an air ambulance ourselves.
Perfect. Thanks, Sarah. So the next question is, where does Hope Air arrange flights to medical care? So we provide flights in all the 10 provinces on hundreds and different routes that we can use. So an example is like if a donor was coming from Kelowna, BC, and they needed to come to Toronto, we would obviously be able to provide a free flight for them. Will Hope Air cover the cost of a companion? So Hope Air provides, of course, like we said, free flights for escorts when requested in the application, and the escort is deemed medically necessary. So we need to get that confirmation from either the specialist or from the referring doctor. Sometimes the specialist is the first time they're seeing the patient, so they can't deem if it's medically necessary. So we would go ahead and ask the referring doctor for that. Of course, all patients who are 18 years and under must have an escort to accompany them, whose flight we would also provide for free. So patients who are 19 years and older, they would receive a free flight just for the escort portion, as long as it's been approved and it's deemed medically necessary by the physician. We would also book their flights as well. And if a patient is driving to the appointment, are they still eligible for accommodation? So yes, so a patient whose residence is about 80 kilometers in distance or more from the medical center, we would be able to provide accommodations. They don't need to receive a flight from us to have just that program. However, I would just quickly mention that when you're on the web form, you would be able to select either if it's just a flight only or if it's just an accommodation only. So you'll be able to differentiate the two. And I think that's it. Over to you.
Great, thanks, Vivi. I meant to actually add on that last point as well. So we do provide up to 5 nights of accommodation per trip. I realize in the case of transplant recovery, that may not cover the entire stay that a patient needs to have, but hopefully it would help to alleviate some of the financial burden associated with the recovery time. So as far as how patients learn about us, I always love to throw this one in because so much of what we do relies on word of mouth and healthcare professionals and social workers. That's the overwhelming majority of how patients are learning about us. And we really appreciate your help in terms of just getting the word out. So many folks are hearing about us from their neighbor, from a poster in the waiting room of their doctor's office. And we really do appreciate your help in being able to let these patients know that we're available to help. And as far as other ways that you can help us spread the word, I did mention putting up posters or pamphlets in the waiting room with your healthcare professional. Alternatively, if there's any community resources that you know of in your community, we'd be happy to send those along. So if you think of anywhere where that might be beneficial, please do let us know. Likewise, feel free to forward our website to anyone who you know who interacts with patients or who may need to travel themselves, someone who's considering organ donation, for example. Welcome to follow us on Facebook, LinkedIn, YouTube, other social platforms to learn more about what we do and also to receive updates for our programs. So for example, our Meals and Rides program were trials in select cities, and now we've expanded it. And the way to hear about that is often through social media. And lastly, we'd love for you to become an ambassador and help us connect to other folks or resources in your community and help us get the word out that we're here to help. And I'd like to close off with a quote here that says, "It's incredible the relief patients feel when they know they can attend a medical appointment safely and that there will not be any financial burden." It really sums up why we're here chatting with you today, why Hope Air exists. We're here to help and hopefully help to provide some sense of relief from the stress of having to access medical care for a lot of folks. So here we have Lavini's contact information, since she's the one who is leading the partnership on Hope Air's end with UHN. She's the go-to for any questions that you have specific to UHN travel, that sort of thing. And so, yeah, her number there is 1-877-346-4673, extension 227, and email is bsolanki, so BSOLANKI @hopeair.ca. Thank you all again for joining us today. And I'm happy to open it up for questions. Candace, I can maybe hand it over to you if there's any questions from the chat or anything.
Wonderful. We don't have any questions from the chat yet, but if anybody wants to unmute themselves and ask a question or add it in the chat, that would be great. Just thank you both so much, Trina. Thank you so much for sharing your journey with us today. We're really grateful for everybody coming together and providing some more information today about this. And again, we have 2 people on the line from PRELOD as well. So if you have any questions about that, one of the questions that we have that comes up a lot about the Give Life UHN fund is what the process that the donor should do first. So should a donor apply to PRELOD and then apply to the Hope Air Fund? Should they apply for the Northern Ontario grant? There's all of these wonderful different resources out there. So I'm wondering if somebody can speak about what that kind of process would be best to go through.
I can answer the part of Hope Air section. From my understanding from all the different back-to-back meetings that we've had, is my understanding is patients go through PRELOD first. And then if that's not possible, then I guess Hope Air comes into play in terms of booking a flight for them. And if accommodations are needed, we're able to do that. With the travel grant, even if we were to book a flight, the patient can apply for the Northern Health Travel Grant. They would just need to submit that paperwork to us because Hope Air gets reimbursed for the flight.
And we have Andrew here too, so hopefully he's got some more information as well.
I would agree with that. PRELOD should be applied to generally before Hope Air. Northern Health Travel Grant, usually we do, applicants should go through that before PRELOD. So a little bit confusing, but we can generally work these things out with applicants.
Okay, wonderful. And one of the other questions that we had from somebody is the restrictions to hotel stays. So I'm wondering how many days post-transplant are available for patients, or if it's overall a number that is given for both, or sorry, not patients, for donors, for both the workup process and post-transplant donation.
Yeah, so it's up to 5 nights for every time that somebody has an appointment and needs to travel.
Okay.
And so there isn't a limit per year, for example, or anything like that, but it is limited up to 5 nights per trip.
Wonderful.
Essentially, yeah.
Okay.
I should also mention too that I don't know if it applies quite as much to this group, maybe it does, but that can be broken up around the hospital stay if necessary. And so, for example, if somebody's appointment is really early in the morning, it's impossible to fly in same day. They can fly in the night before, stay 1 night in the accommodations program, and they still have 4 nights eligible at the end of that trip.
Wonderful. And I guess something that we should clarify too, that a lot of people have asked me, is through the PRELOD program, you keep your receipts once you've gone through these things, and they can be reimbursed through this PRELOD program. And you can either have your reimbursements sent in at different times, or you can send them all in a lump sum after everything has been done, after the transplant's been done, or after the procedures have been done. And Hope Air, however, books things on behalf of that person. So there's a little bit of a difference there, that you guys would actually be the ones who would book the flight, book the hotels, and then provide the meal vouchers. Is that correct?
Yes, that's correct. Exactly.
Yeah. Okay, wonderful. Wonderful. All right, just checking in the chat here. We did have a question about another session about transplant procedures and medical recovery. So anything about the donation process, we have lots of webinars. We have one that happens once a month, which is information for potential living donors. And you can register for that at givelifeuhn.eventbrite.ca. And those happen once a month. We have different webinars every week. But for this specific webinar, I'm wondering if anybody else in the chat, I know we've got a couple social workers on here as well. If you guys have any questions, or if there's any potential donors out there who also have any questions. Yeah, go ahead, Liz.
Hi, thank you very much for this webinar. It was very, very informative. I appreciate it. I just had a quick question. So I am the social worker in the liver transplant program in Manitoba. And so we have patients that are waiting for a deceased donor. So they fly air ambulance anytime. Can I apply on their behalf for the accommodations and the meals like after they arrive? Because that's not something that I can kind of pre-plan because we just don't know when they're going.
Yes, certainly. So we would just need a request for the patient. And then you would just need to let us know in terms of how many nights are needed. So yes, you can definitely put in a request on their behalf, and then we could just discuss offline in terms of how many nights you need. And the meal vouchers are provided either through the Uber Eats program. So they would just need to have a smartphone and need to be able to download the app. If it's through our partner hotels, then we do provide a meal voucher through the hotel, would give them a meal voucher that they can use in the hotel.
For people who are coming out of province, it can be really scary to think about Toronto because it's a big city, and some people have never been in a city that's that large, or even if they have, they've never been to Toronto. And so finding their way around the city, I'm wondering if you guys provide any information about, you talked about meals, about how to get Uber Eats. Would that go directly to the hotel for them? They can decide where they want to have those meals as well.
Yeah, so when we book the hotels and the flights, and like I mentioned earlier, they do get an email. So there's a lot of information in that one email that will give them the specifics in terms of where the the address of the hotel. If it's Uber Eats, they can definitely just get the app, and once they put in the hotel address, I'm assuming there is like the nearby restaurants or anything that's close by that they could either pick up or could be delivered to them.
Wonderful. And I guess that's the biggest thing that I'm taking away today, is that you guys are really walking people through all of the steps. So, once they're going to, let's say, that big scary transplant day, they have their flight booked by you, and then they have travel from the airport to the hotel that they're going to be staying at. At the hotel, they're able to have support to check in, and then they're able to have meals at the hotel or wherever they're going to be going, and then transportation from that hotel to the hospital as well. So you're really covering any step that somebody needs to take from stepping onto that plane to getting into that hospital, which is absolutely amazing.
Yes, and our communication is very clear. In all our emails, it will even tell you in terms of, what time you need to arrive at the airport, certain fees that we don't cover. So people are well aware that they may need to take extra cash or credit card to pay for fees that Hope Air doesn't cover.
Wonderful. Andrew, I'm wondering if you can talk a little bit about some of those expenses that donors can submit. So are there maximum amounts financially, or how do people know what to keep? Is it everything from parking and mileage? So how does the donor go about keeping those receipts to know when they've hit their maximum, I guess would be a question for you.
It's probably best for me to turn over to Leah here. She administers, and I'll step in if there's anything that I feel I can add. So Leah, over to you to answer that.
Thank you.
So we cover quite a few categories for the preload program. So we'll cover travel up to $2,000 for a living liver or organ donor, accommodations up to $2,000, and we require receipts for accommodation expenses. So the applicant has to submit those. It's up to $175 per night. We provide a meal allowance of up to 7 days where the applicant doesn't have to submit receipts for those. We also cover the loss of income. So we do provide loss of income subsidy for applicants who do proceed to surgery for up to 8 weeks post-surgery. And it involves either applying DEI or if they're self-employed, sending us their documentation like tax returns and CRA assessments. We sometimes take into consideration expenses that aren't covered by OHIP, like lab fees and lab testing. It's on a case-by-case basis for now, so we have to review the expenses incurred and match those up with receipts submitted. We also cover companion expenses. So if the donor does proceed to surgery and requires to come with them, either out of province or within Ontario, we'll cover companion to $2,000 similarly to the donor. We'll also cover patient expenses where the donor is recovering in hospital and the companion needs to stay at a hotel. So again, it's similar to what the donor is reimbursed. It's $175 a night, and the category maximum there is $2,000 as well. And we also cover meals for the companion during the surgery period, similar to the donor. So it's up to $30 a day for 7 days, and it's during the time that the donor is in hospital recovering from their transplant. So, yeah.
So a question about that we get a lot, a question about support for donors who have loss of income. If they are covered by, let's say, a short-term disability support, or they have Ontario disability support or something along those lines, is there support to top up what those people are missing from that income? Or how does that work with income support?
So the loss of income subsidy isn't a top-up program. It's for donors who don't have other resources available to them, like short-term disability. Now, for donors who qualify for EI, there is sometimes a waiting period where they don't receive any benefits from EI. If they send us in their statements and receipts, we'll cover that waiting period from EI where they don't receive any benefits. Likewise, self-employed donors can send us their tax returns because they don't qualify for EI. And we'll the last 2 taxation years, and we can figure out what they qualify for in terms of loss of income from their tax returns and their CRA assessments for post-surgery.
Wonderful. Okay, that clarifies it. Thank you so much.
Yeah,
and anything else that you guys think would be beneficial for either social workers to learn about or donors to learn about the PRELOD program?
I would just add that we do review PRELOD every year. Well, we review it on an ongoing basis, and we're certainly appreciative of the fact that costs have gone up significantly over the past couple of years, particularly accommodation and probably some travel expenses as well. So we're currently in the process of developing kind of an update to the program. We administer this program on behalf of the Ontario Ministry of Health, so any kind of changes have to be approved by them, but we're hoping to submit that fairly soon. So early in the next fiscal year, we should go live with some improved kind of reimbursement amounts and some expanded categories as well. So we certainly we survey all our PRELOD applicants every year, and we certainly consider that feedback carefully, and we're always aiming to improve it. So that said, we still appreciate there are gaps in it, and fortunately we've got organisations like Hope Air who are able to kind of fill some of those and provide an important service. But hopefully, working together with these organisations, our aim is certainly to kind of create cost neutrality for living donors, and hopefully remove cost as a barrier to donation.
Absolutely. So well said. Thank you, Andrew. And if people want to learn more about PRELOD, if they are potential donors who want to look at this information, what is the website that they could go and take a look at more information?
I'm looking to Leah to rhyme off the top of her head. It's the Trillium Gift of Life.
With the Trillium Gift of Life Network, it's under, I believe, the section titled Transplant, and it's all the way at the bottom of the page. So you'll have to scroll down to the bottom to look up the PRELOD forms and applications and things like that. Alternatively, you can refer applicants to me and I can send them the application forms or the brochure or answer any of their questions for them.
Brilliant. Thank you so much. I would just like to say a great big thank you to Sarah and Bhavini, and thank you so much, Trina, for sharing your story. Thank you, Andrew and Leah, for joining us. And if anybody has any questions, the 4 people and as well as Trina, who have been part of this webinar, are incredibly wonderful and easy to access. So feel free to reach out and they can support you. And anyone who is interested in being a potential donor, thank you so much from the bottom of our hearts as well, because you are absolutely saving lives. So thank you to everyone who attended today and for all of our amazing speakers. We hope that programs like these will support donors in knowing that we want to care for the whole person that is going through this journey. So thank you so much, everybody, and we will be in touch. Have a great day.